Good morning, everyone. So good to see you all. Good morning. Oh, that's right. Good afternoon. Thank you for that. It's morning somewhere. Thank you, Mayor. Thank you for saving me on that one. We are going to wait just a few more minutes, if you don't mind, to allow people to register and to come on in. We do have a live stream of this so we welcome any participants who are viewing us through the live stream. My name is Maria Bynum. I'm with the U.S. Department of Housing and Urban Development, and I work right here in the state of Delaware, Wilmington. So glad to see you all. Give us a few minutes. While you're sitting, since we want to get to know each other and to engage with one another, if you don't know the person sitting next to you or down the row from you, if you want to introduce yourself, that would be awesome while we wait to start. So give us just a few more minutes and we'll get started. Thank you. Good morning, everyone. We'll get started in a few minutes, so we still have people in line. So please bear with us. Good morning, good afternoon, good afternoon. I'm going to get it right. Good afternoon, everyone. Oh, I love to hear all this chatter. That means we're talking about things that we're going to do together, right? And we're meeting new partners. So that's really awesome. This is what this is all about. So if I can have your attention. All right. Well, good afternoon. I got it right finally. My name is Maria Bynum, and I am so happy to see you all. I am with the U.S. Department of Housing and Urban Development. I work in the Delaware office in Wilmington, and we love traveling to all parts of Delaware, so please invite us. We love to be part of what's happening in the first state. I wanted to welcome you today. We are part of the Region 3 Interagency Council on Homelessness, and this is the educational session and resource fair that we've invited you to, and we're happy to see you here today. We look forward to sharing some information you can use and having a dialogue with you throughout the afternoon. We don't take it for granted that you're here today. We're happy you joined us on this crisp fall day when there are so many other demands on your schedules. So we are very fortunate to have you, and we thank those who are joining us by the live stream today. Many could not be with us, and hopefully you're able to join us via the live stream. And we will have that live stream available after this. So if you'd like to share it with some of your colleagues or partners that weren't able to be here today, we certainly welcome you to do that. And we will send that information out to you so you know how to get to it and you can share it with others. Our theme today is power and unity, mobilizing to address homelessness in Delaware. And, you know, we're here as federal partners. I don't know if you remember that song by Sister Sledge, I Got All My Sisters With Me. Well, today I feel like I got all my federal partners with me. And so we're excited that they're here in full support. And we work under that umbrella of the Region 3 Interagency Council on Homelessness. We are using our power, our might, in unity to try to address homelessness at the federal level. And today is all about telling you what we bring to the table because we know you are out there doing this every day. On the news this morning, I heard that today is World Kindness Day. And I was thinking that's such a great descriptor for all of you here today because it's the kindness, the compassion, the lifeline that you provide to those you serve, to those who are homeless, and you're helping them to find housing and supportive services and the things they need to survive and to thrive. And we thank you today for all you're doing at the local level, the state level, and we just want you to know that as federal partners, we're here for you. And we want to share what we have that hopefully can help you today. Now, we have in your folders an agenda, and we're going to try to keep to that agenda, but we have a lot to share today, so forgive us if we go, a little askew. But our hearts are in the right place. How this is going to work is we're going to do some presentations from our federal partners, and then we're going to allow 1 or 2 questions from the floor after those presentations, and then there will be several opportunities to break for about 10 minutes. So what you've heard in these presentations today may, have you think about some questions you want to ask. Well, when we break, you'll be able to go to the room right outside this door to the left and talk directly with the federal partners. so that you can get information one-on-one that we won't be able to do here in the bigger forum. So just remember that. If you've got a burning question and we don't get to it, you'll have an opportunity to visit with our federal partners in the room outside. We are hoping that this will be the first of a series of information sessions. So we're doing this in person today and live streaming it, but maybe in the future we'll do some more virtual webinars. So you'll see throughout the course of the day a QR code on the screen. It's not there right now, but it will be. And so I want to let you know that we want to hear from you. What are some things that you want to hear about? Maybe we need to do a forum with philanthropic organizations. Maybe we need to do a forum with state agencies and what they can provide. So we need your feedback about what today's session was like and then what you'd like to see in the future. And let's see if we can't make this a habit where we are always engaging and sharing information. All right. I want to acknowledge our partners today, the City of Dover. A hand for the City of Dover. The Housing Alliance Delaware is also here, and they were a partner with us in this. And I just want to mention our HUD Delaware team members. Benita Johnson was out where you registered. Clark Shanahan is here in the front. Stand up, Clark. And we are here to service you. And, if you need anything, please let me know, or Clark, or Benita. And we're so happy to have from our regional office all the way in Philadelphia, Charles Anderson. He is our supervisory management analyst. He is the data analytics guy, so he's counting who's here and what we talk about so he can report it appropriately. So thank you for coming all the way from Philly. And I have another very important person from the HUD regional office, but we'll save him for a few minutes later. I also wanted to acknowledge our federal congressional delegation. We have with us Kate Rohr from Senator Coons' office. She's all the way in the back being a wallflower today. Oh, there she is. Yes. Good to see you. Thank you for coming. They always support us, so I'm always happy to see them. And then we also have San Jerry Camias, who is from Congresswoman Lisa Blunt Rochester's office. And I understand they are in D.C. today, lots of votes going on, so we're sorry they couldn't be here, but we're so happy to see all of you. So now, without further ado, let's get this resource fair started. This is what you came for. So I am so excited to introduce someone who has worked with HUD and so many other agencies in the homeless arena. His name is Dover Mayor Robin Christensen, and I am always happy to see him. We have worked together in the past. He has been a leader in this city, but also across the state. So, Mayor, will you come and welcome us to your beautiful city?
Is it morning or afternoon? Good afternoon. Oh, we can do better than that. This is Dover, Delaware. Good afternoon. That's good. I'm not a very good public speaker, but I asked Reverend Moore that after I spoke if we could pass the collection plea, and he gave me permission. Ladies and gentlemen, I stand before you today with heartfelt gratitude to Dover Christian Church and Reverend Moore for hosting this most timely and important event. As a community, a state, and a nation, we are confronted with a critical need: the plight of our unsheltered citizens, both young and old. Many of these individuals not only struggle with the immediate hardship of homelessness, but also face deeper challenges such as drug, alcohol addiction, human trafficking, abuse, PTSD. This condition is especially prevalent among our veterans, both men and women, who have bravely served our country and now face an uncertain future. It is, in my view, unacceptable that we continue to pour millions of dollars into supporting fair weather allies abroad, while our own citizens remain unsheltered and without hope of a better tomorrow. We must ask ourselves, where are our priorities? Today, I urge each of us to take action. Let us come together as a united front, an organization of collaboration committed to taking meaningful steps toward addressing this urgent issue. This is not a problem that can be solved by a few. It will take collective strength of many and the courage to act without seeking personal gain or recognition. As Ronald Reagan wisely said, there is no limit to the amount of good that can be done if you don't care who takes the credit. Thank you.
I wanted to ask, thank you so much, Mayor. Always a pleasure to have you among us. I wanted to introduce Dover City Councilman Gerald Rocha. He has been such a hospitable host for us. He's opened the doors of the church, as has the pastor, to let us come in and take over, for today anyway. And I wanted him to come and recognize his pastor and his fellow council people.
Thank you. Thank you. Okay. Good afternoon, everyone. This is my own piece of equipment. First of all, I'd like to recognize HUD when they first brought this opportunity. Of course, I'm here with my pastor, the Reverend Dr. John G. Moore Sr. Let's give him a round of applause, please. Even though I'm a trustee, I still am obedient to asking his permission if we're allowed to open the church doors to have such a wonderful event. And he graciously said we could. And we think that it's good to show how the church engages into the community, because we know that homelessness is definitely something that we're all concerned about. And we know that it's getting colder, and we want to make sure that we provide as much shelter as we can to as many citizens that we can here in the city of Dover, which is the capital, and we want to make it a welcoming destination for all. And of course, we want to make sure that our citizens here are covered and have shelter. I have been working with the mayor and individual that's here to my left, Mr. Alex Cropper, who was the chair of our unsheltered working group that we have here in the city. And we've put together what is called the Kent County Coalition. And this coalition is a group of agencies that we're going to partner with throughout the city to make sure that we have the wraparound services as we embark on collectively working together to provide housing and, if needed, a primitive campground that we plan to put, an area there that we can, provide heat for those that may be even in the tents, and meeting them at that low level and giving the wraparound services, having the wraparound services already set aside and available to these individuals as we start to work with them, and we're going to have mental health services to wrap around as well, to get them from where they are to hopefully where they need to be, and developing a relationship and bond with these individuals that may be overlooked and many times overlooked. So on behalf of the city of Dover, my colleagues that aren't here right now, but I know that I'm expecting Councilman Lewis and also Councilwoman Dr. Pillsbury will be available. They'll pop in probably later on. But as a representative now of the city, since the mayor has just stepped out, I just want to say welcome and thank you for your attendance at this very crucial resource fair. And if there's any way we can connect, please feel free to reach out. I have my business cards available, and I just thank you for this opportunity.
All right, thank you so much. You know, I mentioned earlier that our theme today is power and unity, mobilizing to address homelessness in Delaware. And so one of the things I asked my federal partners to do is to introduce themselves and then identify their superpower. So I didn't do that, federal partners, so I'm going to take the opportunity to do that now. I am the Delaware State Field Office Director, and so I feel for my team, our superpower is customer service. We are often considered the front door, and so we get calls, letters, we get walk-ins, and so we're always trying to help those that come to us, and many times we have to ask you all to help us with that. So we thank you for that, but I wanted to at least be the example to my federal partners that our superpower in the Delaware Field Office is customer service. So what's your superpower? I'd love to hear about it. So let's chat about it when we have our breaks. So I want to give a shout out and a welcome to one of my superheroes at HUD. That is our regional administrator, Matthew Heckles. I'm going to ask him to come up because it's been such a joy to work with Matthew Heckles. And most of you know him. He worked with the Delaware State Housing Authority, and he also worked with the Wilmington Housing Authority on the board. And he took a short, stop in Maryland for a few years. But we are so glad to have him as our regional administrator. He has been a joy to work with, an expert, a knowledge on policy, all things finance. And so I'd like to welcome him to the podium.
Thank you, Maria. And I'm going to move this a little bit. Boy, I'm going to take you home with me. So I just want to first just thank everyone for being here today. When we brought the Interagency Council on Homelessness back together at the regional level, we looked around and thought, what can we do? We have at the national level the U.S. Interagency Council on Homelessness. At the state level, in different states, you have coordinating agencies of different kinds that come together and work on it. But how can regional representatives of federal government come together and help? And so one of the things that we thought about doing was sort of reconstituting our Interagency Council. And we did that. We got some meetings together, but we thought that breaking off into planning and deciding who would sit on what subcommittee and do what work was not the best place for us to spend the time that we had. And so we came up with this idea of coming out into communities and making sure that we had a way to make federal government more accessible. We know, I think all of you know, I'm preaching, kind of almost literally preaching to the choir here. Because you know that it takes more than housing. It takes more than healthcare. It takes more than education. It takes more than job placement. It takes more than all of those supportive services and housing working together to really help people who are unhoused. And so how do you do that when the federal government is so fragmented? And as Maria mentioned, I've spent my career really in this work. And I spent a lot of that time looking at HUD and looking at other federal agencies and saying, how do I work with them? How do I get access? How do I understand how those federal agencies can support the work that I'm doing either in Delaware and Maryland, other places where I've worked? And so to me, that's really an important part of what we can do at the regional level. And while Maria's description of her superpower is great, customer service. I think it's great. I think it's a little incomplete because not only is our Delaware office and the other federal agencies that are represented here today sort of responsible for that incoming of customer service, it's also important for us to go through that front door and out into our communities. And that's a big part of what we're trying to do here today. It's just important for us to make sure that we are bringing all of those assets together across government and up and down through government to serve the most vulnerable people in our communities, wherever they may be. The Federal Strategic Plan to End Homelessness that we called All In has a goal, and it's always important to put out goals. We're developing strategies to reduce homelessness by 25% by 2025. The problem is that we're facing significant headwinds. When you look at the cost of housing, we're seeing increases in homelessness in areas and with sort of subpopulations that I think you can link back to the cost of housing. We're seeing more older households that are becoming homeless. And if you think about someone on fixed income, Social Security income, if their income has not gone up to keep pace with rent. You see the impact of increased housing costs, not just the cost of financing the home, but of keeping it up. So things, repairs that need to be done to the home, all of those things can contribute to a family becoming homeless. And we see that across the board when it comes to our homelessness numbers. But then also, the sort of, I guess we've called them different things, but special populations or people that need a different approach as well. Youth homelessness is something that we're particularly concerned about. I've got 3 boys. 2 are in high school, 1's in elementary school. I don't know what they're saying half the time. So if we think that we can engage a homeless youth in the same way that we engage, a veteran or an older family, we're doing it wrong. We've got to find different ways to communicate and to talk with them about the programs that are available and about the ways that we can help them, and just provide a different vision for how their life can be different moving forward. So I'm just really pleased that all of you are here today. I think Delaware is a pretty special place, and I think that there's a lot of really good things that happen in Delaware because there is built-in collaboration and a real sense of community here that you don't find everywhere. If today is part of a conversation that leads to the federal government and the different agencies that are here today to support the work that you do, then I think we will have done what we came here to do. So we're going to start that now with a few folks from HUD and from the Veterans Administration. Don't go that way. No, come on up. And we're going to talk a little bit about the programs that we run. Now, some of you who interact with HUD and other federal programs on a day-to-day basis may know a lot about this, but we want to make sure that we cover the bases. And so by the time that you leave here today, you'll have a good understanding of all of the different things that these federal agencies offer. And you'll hear from HUD on housing, you'll hear from VA, HHS, USDA. There are a lot of different agencies here today that are going to give you a perspective and hopefully light that spark and make you think differently about the way that you have thought about your programs and how you can engage with us in our different agencies. So first, I'm going to turn it over to Marion Staley. Marion is from our regional office in Public and Indian Housing, and she's going to talk about some of the programs that they run that can be of use to the clients that you serve. Marion?
Thank you. You hear me? And good morning. I'm Marion Staley, a portfolio management specialist in the Office of Public Housing out of our Philadelphia office. Our office's superpower is housing. That is our superpower. Now, I would just like to go over some of the public housing programs, all right? So first, we can talk about public housing. It provides decent and safe rental housing for eligible low-income families, the elderly, persons with disabilities. Public housing comes in all sizes and types, from the scattered site units to single-family houses. And then the Housing Choice Voucher Program is where a family that is issued a housing voucher is responsible for finding a suitable unit of the family's choice where the owner agrees to pay to rent to the program. A housing subsidy is paid to the landlord directly by the PHA on behalf of the participating family. Now, I would just like to talk about special purpose vouchers. This is in addition to the other programs. Special purpose vouchers. In addition to the Housing Choice Voucher Program in public housing, some of our housing authorities offer special purpose vouchers, which are vouchers used in collaboration with partner referral agencies. These programs provide rental assistance resources to specific populations. To find out which special purpose voucher are offered by the housing authorities, it's best you contact them because some of them offer different ones. They don't offer them all right? So first, I'm just going to review a couple of the special purpose vouchers. And first, we'll talk about mainstream. Voucher assistance is for non-elderly persons with disabilities. Aside from serving a special population, mainstream vouchers are administered using the same rules as other housing choice vouchers. Mainstream vouchers are separate from the regular tenant-based voucher program. And HUD-VASH is Veteran Affairs Supportive Housing. This program combines HUD's Housing Choice Voucher Program, rental assistance for homeless veterans with case management and clinical services provided by the Department of Veteran Affairs in collaboration with participating veterans medical centers, community-based outreach clinics through VA contractors or through other VA designated entities. And next, we have the Family Unification Program, FUP as we call it. This program focuses on homeless prevention by providing housing assistance to families for whom lack adequate housing is a primary factor in the separation or threat of imminent separation of children from their families. And lastly, we will talk about the Foster Youth to Independent Initiative, or FYI. The FYI initiative makes housing choice voucher assistance available to public housing agencies in partnership with public child welfare agencies. Under FYI, the housing authorities provide housing assistance to youth between the ages of 18 and 24 who left foster care or will leave foster care within 90 days. FYI vouchers provide housing assistance and supportive services for youth for a maximum of 36 months. And now, okay, this is the last slide here. So what's presented here, if you can see it, it is our Delaware housing authorities listed. Each of the housing authorities are listed with their executive directors and the general contact number. And what I broke out here was the specific vouchers that each housing authority offers. So Wilmington Housing Authority has the mainstream, the VASH, and the FUP special purpose vouchers. Newcastle County Housing Authority only offers the VASH, HUD-VASH program. Newark Housing Authority doesn't have any special purpose vouchers. The Dover Housing Authority has mainstream vouchers, and Delaware State Housing Authority has mainstream, VASH, and FUP. And lastly, listed there are the other resources. If people are not interested directly in our housing authorities, there's other resources that HUD offers. So that is through the resource locator. It's actually a map, very accessible, or you could use the mobile app. There's also HUD-approved housing counseling agencies that offer an array of services. And lastly, there's other affordable housing options also listed at our website. Thank you.
One of the things I'd like to highlight from that, and thank you, Mary, that was an incredibly efficient overview of a lot of HUD programs. The role of public housing authorities. There are 5 in the state of Delaware, as probably most of you know, but it's really important for us to know those public housing authorities and to know the people and to know the programs and to be advocates for them, but also with them. They have, in many cases, the opportunity to apply for vouchers to be allocated to them, and you can see that there's a difference in the housing authorities and what they apply for and what they're granted. So if there are gaps in the services that are provided through especially the voucher programs in your communities, the PHAs can be a real partner there. They also have policies that dictate how people access their programs, their services, preferences based on, they have a lot of flexibility to create preferences, including whether or not the person is transitioning from a permanent supportive housing unit to homelessness, other preferences that can serve the communities that we're talking about here today, the families that we're talking about here today. So they have a lot of flexibility that they can determine with their boards and with their communities that can enhance how public housing authorities can be your partners to make sure that people have access to permanent housing moving forward. All right, so next we wanted to talk about some of the interactions between the Veterans Administration and HUD, and mostly that is done through the VASH program. And so Karen Favors is here today from the VA Center, and will give us a little bit of an overview of that program. Thanks.
Hi. So first, because I am with the Veterans Affairs and I am a veteran, I would like to acknowledge all veterans that are in the room. So if you don't mind, could you please stand so that we can honor you for your service and your sacrifice. Thank you. So I work with the Department of Veterans Affairs, and I am with the Wilmington VA Medical Center. I actually work out of the Dover Clinic. And as one of the supervisors, we work closely with HUD for with the HUD VASH vouchers. And as stated before, we have vouchers with the Wilmington Housing Authority, Delaware State Housing Authority, Newcastle County Housing Authority, and Newcastle County, Delaware State, Wilmington.
Delaware State, that's it, it's three. It's three.
Okay. Oh, yeah, okay, sorry. And so we work closely with them. So that's one of the areas that we do intervene with, I'm sorry, Maria, my superpower. So our superpower is assisting in getting veterans off the street in various arenas. And so HUD is HUD VASH is the permanent housing portion of it. We do have other areas that we work with within the VA that provide support for veterans in getting them off the street. I don't know if you're gonna, okay. So some of the resources that we have. So we have staff that intervene at the jails and with prisons and who will engage those veterans that are coming out that need homeless services. We also have outreach workers that go out into the community, and we'll work with some of the agencies that may be here now to connect veterans into our services that we have. And so if a veteran is in need of temporary housing, we have one agency that provides that service right now, and that is through a contract that is offered through our medical center to provide emergency shelter. Another program that we also have through the VA is temporary transitional housing, and we have a couple of agencies right now that provide that service for us through the VA. And with those, they get the veterans into HUD VASH, which is the Section 8 voucher, and we from the VA provide the supportive services to help the veterans maintain their housing in the community. And so I can't, there's an overview of the different services that are offered through the VA, because we also work with other agencies that provide prevention funds, which is the Supportive Services for Veterans and Their Families grant, and there are 2 providers throughout the state of Delaware that currently have that grant, as well as our transitional housing programs and our emergency shelters. And so how you can help is that sometimes you're going to come across a veteran, and sometimes they're not going to identify as a veteran, and sometimes they will. So we ask you just to be patient, and that, they're not, may not all have their basic needs met, and that we ask that you understand that They may not have reliable means of communicating or a physical address to provide. And we just ask that you try to instill hope, but never overpromise. And what I mean by that is don't tell a veteran that you're going to do something that you're not able to do. And we ask that you contact us, and I believe that you'll get the slides at the end of this, and you'll have an opportunity, you'll have our numbers for all of our staff throughout the state. So our Wilmington VA covers the entire state of Delaware and 3 counties in southern New Jersey, and we have staff in locations in Georgetown. We have a Dover clinic over on Bay Road, and then the main hospital is in Ellesmere in Wilmington. And we have staff within the homeless program throughout those locations. And we also have the staff that work with the housing authorities with HUD BASH. And if you have questions about that particular program, you can always contact me, and be more than happy to provide you with information. So there's the number for the homeless hotline. That's manned 24 hours a day, 7 days a week. And they will connect, and you can utilize that number anywhere in the country, because that number will connect the veteran to the closest medical center, and an outreach worker will give that person a call back within 72 hours of them placing that call. And here are ways that you can stay engaged if you want to know more about opportunities to do business with the VA or to know what's going on with the homeless veterans. There's information on what you can do to stay connected. And that link will give you take you to the web and give you additional information about homeless services offered by the VA. Thank you.
I wanted to mention a couple of other HUD programs that aren't being covered by Marion and Crystal. The multifamily program at HUD, there are about, I think around 50,000 privately owned multifamily locations that are subsidized by HUD around the country. And they function similarly to the programs that Marion described, in that they are permanent housing with a lease agreement between the tenant and the landlord. But they're privately owned, but they're made affordable through subsidies that run through HUD. And so the problem with that is that each one of them has their own entity, and so they have their own waiting list, their own way to access them. So they're not run through the public housing authorities generally. But that is obviously another resource, and most of the Delaware Housing Search website, for example, has all those multifamily sites located in there. The other piece is fair housing. I think fair housing is something that's really important when it comes to people who are unhoused and perhaps how they became unhoused, but also it's a barrier in a lot of instances to people being rehoused. And so, HUD's role there is to work with the state agencies and make sure that that the federal and state fair housing laws are being complied with in that environment. And so, make sure that we keep them in mind as well, and open doors for people rather than shutting them. A lot of what happens through HUD in terms of homelessness happens through our Office of Community Planning and Development, CPD. And so today to talk a little bit more about what they do is Crystal Edwards. Crystal?
Hello, I'm Crystal Edwards. I'm a program manager in the Office of Community Planning and Development out of Philadelphia. We have a portfolio of grantees in eastern Pennsylvania, and we cover the whole state of Delaware. So our superpower is supporting the entities who do the work. So whether those entities are states, units of local government, or nonprofit agencies, and whether that work be providing services to the homeless or other types of community development work, we are there to support those agencies to run these grant programs properly. Sometimes we have to be the ones to bring down the hammer when programs are run out of compliance, but even in those instances, there's an opportunity to support and provide technical assistance. So that's what we're here for. We're here to make sure the funds are being spent properly and on the right places and things, and on the right beneficiaries. So I'm just going to go through some of our programs really quickly. If you could go to the previous slide. Our first program is the Community Development Block Grant Program. The CDBG program is probably our most well-known. It's been around since 1974. We've been celebrating the 50th anniversary of the CDBG program all year. It's probably our most versatile, flexible program. We, in addition to being able to provide homeless services with these funds, we can also do things like economic development, affordable housing. We often fix up parks and playgrounds and other public facilities and improvements with these funds. They are a source of entitlement funding, so it's just like it sounds. Entities don't have to apply for these funds every year. They're awarded on a formula basis. We have 43 formula grantees throughout Eastern Pennsylvania and Delaware. In Delaware, we have 4. I'll get to that on the next slide. And unlike the CDBG program, the Continuum of Care program is a competitive program. So each year, nonprofits apply for these funds through a competitive process. The program is designed for coordination among the community members to with the goal in mind of ending homelessness in the community. So it's an opportunity for all of the nonprofits and units of local government to come together and decide what the needs are in the community, who should be awarded funds and what they should be spent on. The Emergency Solutions Grant Program is another source of entitlement funding awarded to states and units of local government. It is just for homeless services. So unlike the COC funds, these can be spent on shelter operations and other essential services. And then we have the Home Investment Partnership Program, which has the goal of creating and preserving affordable housing. And all of these programs are meant to serve low and moderate income people. So the CDBG program, the national objective that we have to meet every year, if you are awarded these funds, 70% of these funds have to be spent on activities that benefit low and moderate income people. Next slide. So here's just a snapshot of these sources of funding in Delaware. Who has them? So our entitlement grantees are the state of Delaware, the city of Dover, city of Wilmington, and Newcastle County. You can see the types of entitlement funds that they get. Everyone gets CDBG, and then the state also gets home, ESG, RHP, HOPWA, which I didn't talk about, which is the Housing Opportunities for Persons with AIDS. It helps to house those with AIDS. And the Housing Trust Fund program is awarded just to states, and it is meant to preserve and produce affordable housing. And then our Delaware COC funding funds 30 projects through 10 nonprofit recipients, and the total amount awarded in Delaware is about $10 million. So that is all I have. I will be outside for questions.
Maybe I can just leave you with this. There are a lot of different programs, even just within HUD, let alone the other agencies that we'll hear from today. How we use them in Delaware very much depends on the decisions that we make within Delaware. A lot of federal programs come with a box within which you must work, and it's important to stay within that box. That's the HUD part that I have to say. The part that I think is what I have seen in my travels around the region over the past several years is that there are a lot of different ways to stay within that box and to maximize those resources by working together, by leveraging funds, by having a good plan, by understanding the data, and making sure that you stay within the box, but that you're creative and progressive and maximizing those set resources. You know, we have some folks from our congressional delegation here today, and we should continue to ask them for more resources, of course. However,
is that applying pressure or what, right, Sanjay and Kate?
However, even if they give us more, we will still be constrained by the resources that we have. So it's very important for us to maximize that. And there are so many different ways that we can go about that, using the programs that were just described. Even the Section 8 voucher program, project-basing those vouchers can be very effective in terms of providing someone with permanent supportive housing when that's matched up with low-income housing tax credits and supportive services. That's just one example of how Delaware probably can be doing more with the resources that it has to stretch them and to make sure that we are doing the best that we can with all of them.
All right. Now it's your turn. Does anybody have a question? No? All right. Oh, one question over here.
Once you get off that easy.
Mind you. Mike, if that's okay.
Hi, my name is Abia Lucas. I am a community educator for Christiana Care at the Newcastle County Hope Center. So I do work with participants who are experiencing extreme homelessness and people who are experiencing disabling conditions which are preventing them from seeking housing opportunities. And I was wondering, does the SRAP program intertwine with the Section 8 program? And how would one get onto the SRAP program and get into that?
You guys want me to take that one? So the state rental assistance program was actually created to kind of fill a gap between, I mean, the reality is that a lot of these federal programs, especially when it comes to public housing and Section 8, have very long wait lists. And so it's important to get on those waiting lists. It's important to, to engage with them, and I think we can do more about that, and maybe there's some news coming up later this week about how that's going to improve in the state of Delaware. But SRAP was really created for special populations that need housing now to bridge that gap. The program was created in a way that it mirrors the federal program so that there isn't a disruption when the person transitions from the state program to the federal program. But that's a really great example, I think, of how state resources can work with federal resources to kind of stretch things out and to create, if people get into the SRAP program and are housed with the SRAP program using state funds, but then have a place to transition to in the federal programs, then that frees up more resources. So the application, I think, for the state rental assistance program is still with the Delaware State Housing Authority. And so to your specific question, I think that's where to talk to about that. But thank you for what you do. The Hope Center is, in my mind, one of the greatest assets that the state has created in a very, very long time. I would even maybe say decades. When I had the opportunity to bring the Secretary of HUD to Delaware, we went to the Hope Center. When I was given the opportunity to bring the Director of the U.S. Interagency Council on Homelessness to Delaware, we went to the Hope Center. And in both cases, they came back, and these are people that see a lot of stuff and know a lot of stuff, and they said that's really a transformational place. And so the work that's done there, it's not just the building, it's not just the way that it all works, but the way that you and your colleagues approach people, I think has a big impact on success. And I think that's something that we can all learn from the Hope Center and from other programs in general is it's not good enough always to just do the right thing from a programmatic perspective, but we've got to treat people with respect and with dignity and invite them in to places like the Hope Center as guests as opposed to people who are that need services and therefore we don't have to do our best for them.
Thank you so much. Sir, could I ask, could we take your question after this session? We are a little bit behind time. We started a little late, and so I want to make sure everyone gets a chance to visit with our resource tables. So I did want to mention that Housing Alliance Delaware's director, Rachel Stucker, is here, and she is available if you have questions after the session, or during our breaks, I should say. And so at this time, I wanted to do something very special here. We have been talking about our programs, and one of the reasons we want to show you the money, what our federal funding streams might be, and how you might be able to take advantage of those. And so we wanted to highlight how one of our housing providers, our homeless providers, was able to take advantage of HUD funding. Crystal mentioned the HOPWA program. And I'm going to turn it over to Matt to do the honors because we are presenting some money here today. And I'm going to ask Jean to come on up so that we can do that. And then we will retire to the resource room so that you can talk with some folks that you have an interest in sharing one-on-one conversations with. It's all yours.
Well, thank you. The Ministry of Caring has been a partner of HUD's for a number of years, and I think in Wilmington certainly provides critical services to people with HIV/AIDS, and has for a long time. It's an interesting sort of evolution as we have improved our understanding of the healthcare needs there, and improved our delivery of healthcare. People are living longer with HIV and AIDS, and so while still needing the supportive services and the healthcare that goes along with that. And so providing them with stable housing is a big part of the whole package. And that's really what the HOPWA program does. Housing Opportunities for People with AIDS was a program that's been in existence for a number of years, and helps to support agencies and nonprofit agencies that are serving people with that disease to engage in supportive services and be housed in a permanent way safely. So we are pleased today to award $807,520. To make sure that the Ministry of Caring has the opportunity to continue that work. And Jean, if you don't mind just sort of giving us a little bit more detail about what the program does, that'd be great.
Good afternoon, everybody. Let me begin by thanking the Department of Housing and Urban Development for providing these funds to what we call House of Joseph II at the Ministry of Caring. These funds will be used to directly support House of Joseph II in providing care for individuals diagnosed with HIV who also typically have experienced homelessness and have other physical or mental disabilities such as diabetes, COPD, tuberculosis, herpes, strokes, anxiety, and depression, in addition to their HIV diagnosis. And let me just tell you, first, let me point out my colleague Sarah Schultz here, who is really the person that wrote the grant. So if you're unaware, the Ministry of Caring operates 19 programs at 30 different sites, mainly throughout the city of Wilmington. And usually after I say that, I also point out that we serve everybody in the state. So we have people that come up from Dover. We have people that come up from Smyrna, wherever. Our doors are open to anybody in the state of Delaware. All right. In addition to House of Joseph, we operate another facility with people living with HIV. We also operate a whole system of emergency shelters, transitional housing, and longer-term housing, 3 dining halls, 2 child care centers, 3 senior citizen housing complexes, with a 4th hopefully going to settlement in January, job training, drug and alcohol, mental health counseling, and a distribution center that provides food, clothing, and household items such as furniture to the Wilmington community. Yes, we are a complex affair, but it also reflects the Ministry of Caring's motto that the poor should never be treated poorly. Excuse me. House of Joseph II was originally founded in 1997, essentially to provide hospice care for the poorest citizens diagnosed with AIDS and experiencing homelessness. It was a very different time back then when there were few options. Fortunately, due to medical advancements, we live in a different world. House of Joseph has become a facility providing housing and medical care instead of hospice care. We now have residents who've lived at the facility for 20 years. Just confirmed that this morning. In some cases, their only family is their fellow residents and staff at the House of Joseph. The HOPWA funding Ministry of Caring is receiving today will go to support the direct care of House of Joseph II residents, whether that be medical, psychological, nutritional, social and emotional health, activities, or upkeep of the facility itself, so that residents can lead as fulfilling a life as possible. The House of Joseph staff make sure residents not only have a roof over their head, are well fed, get to needed medical appointments and receive medications as would be expected. Staff, however, go beyond that and assist the residents in building a true community that cares for one another as a family. House of Joseph staff support residents in having a life beyond the facility by organizing social outings, encouraging engagement with 2 local high schools, and other activities that, again, have residents live a fulfilling life as possible. They live beyond the facility. Our residents are really quite unique individuals. For example, we've had an individual who's maintained a garden there for over 20 years, or for 20 years. He's the fellow that's lived there for 20 years. Now that he's faltering, other residents and staff step up, and the garden continues. So, you know, just a little quick glimmer of some of the stuff that happens. So again, I thank the Department of Housing and Urban Development for the HOPWA funding that's been provided to the Ministry of Caring, and I offer an additional thank you from the residents and staff at the House of Joseph for helping make such a program possible.
Thank you so much. Certainly heartfelt. I know many of you have stories that bring tears to your eyes, as Jean experienced here today. And so that's why we're here. We want to help you as much as we can. We may not have all the answers, and we may not be able to help you with the funding that, you know, Jean, the Ministry of Caring has. But we want to at least give you the information to empower you. So with that, I'm going to ask that you proceed to our resource room. We have our federal partners waiting for you. We also have some snacks and drinks so that you can stay hydrated and energized this afternoon. So please take a moment to go and talk with our federal partners, and we will reconvene in 10 minutes. So let's say 2:25. 2:25, let's come back. We have HHS here, Health and Human Services, SAMHSA here as well. So we want you to come back. Calling all federal partners, our attendees. See, once we get started talking, we can't stop, right? We have so much to share. But we don't want you to miss another thing. All right. As people are coming back in, I just want to mention that, listen, I might have. Just want to mention that we have so many of you in the room. If you didn't sign in, please do, because we'd like to communicate with you after this. We'd like to share the PowerPoints from today, so you have that handy if you need to review those. And we'd also like to share the live stream so that if you have others that want to see it or hear some of it, that you can share that because it will remain live. Not live, but it will remain active, after this program is over. So let me see. So we put in your folders the bios for our speakers. So I'm not going to do a big intro with the bios of our speakers, but I am going to ask Trish Danner to come to the podium. She is with Health and Human Services. She is the Regional Outreach Specialist, and I'm then going to let her take over. You're welcome to sit at the table or stand here. Here's a clicker in case we are. So let me go run and see if we can't get the PowerPoint going here. Trish, it's all yours.
Okay. Hello? Okay. There we go. Because I'm very soft-spoken otherwise. So I'm Trish Danner. I'm the Regional Outreach Specialist with the U.S. Department of Health and Human Services. We do have a PowerPoint to share, but I'll get started in the meantime. The mission of the U.S. Department of Health and Human Services is to enhance and protect the health and well-being of all Americans. And you may not realize all the agencies that fall under HHS, such as SAMHSA, HRSA, Health Resources and Services Administration. We love our acronyms at HHS. The FDA, the CDC, the Centers for Medicaid and Medicare Services, the Agency for Community Living, are just a few of the agencies that fall under HHS. So I mentioned I'm the Regional Outreach Specialist. We have 10 regions across the country. We are Region 3, so we have Delaware, yay, Pennsylvania, Maryland, Virginia, West Virginia, and the District of Columbia. So we serve as a liaison to all of our states for any issues they have with the agencies or any help they might need. They contact our office and we help smooth the path to get the help they need. So ending homelessness before it starts is a federal homelessness prevention framework. Do we have it? Okay, no. Prevention is critical. 653,104 people experienced homelessness in 2022. That's unacceptable. That's just way too many people. However, almost 300,000 people moved into permanent housing in 2022 from shelters, transitional housing, safe havens, and rapid rehousing. The Federal Homelessness Prevention Framework details steps for developing a community-wide cross-system approach to homelessness prevention. It defines the categories of homelessness prevention, shares promising practices for prevention, and lists federal resources that can be for homelessness prevention. And it was developed by the U.S. Department of Health and Human Services, Housing and Urban Development, Department of Agriculture, and the Veterans Administration, but it was informed by people who lived with the experience of homelessness, which is so important. And it was developed for federal agencies, local, tribal, and state governments, nonprofit funders, systems providers, and advocates of housing, health, human services, justice, education, employment, child welfare, and emergency services. So we all know that if you don't have a safe place to be, you're not living in a healthy situation, in a healthy community. We all need to have housing to have a healthy community. So under the federal government, we want to provide equitable opportunities for people to achieve optimal health and well-being through prevention, diversion, and rehousing and stabilization. HHS programs that address homelessness fall under the Administration for Children and Families, the Center for Medicaid and Medicaid Services, Health Resources and Services Administration, and Substance Abuse and Mental Health Services. No, that's okay. I was talking, I don't know if he's still in here, Mike, with Code Purple, and the work that they do here in Delaware is absolutely amazing. If you're going into Rehoboth Beach, there used to be a state trooper building that they tore down, and he has 28 tents there, 14 men and 14 women that they were providing housing with, giving them dignity. They have porta potties, they have dumpsters. He was even telling me they have like a deed for their little property there, and it's been a great success. I do a lot of work around human trafficking, and runaway teenagers are approached by a predator within 24 hours of running away for human trafficking. So can't say enough how important it is for teenagers and everybody to have a safe place to go, a safe place to live, for everybody to live in a healthy community. So thank you to everybody here for all you do to help the homeless. And I appreciate your time. And I want to ask Jeannie from SAMHSA to come up and talk about a couple programs real quick.
Hi, good afternoon, everybody. My name is Jeannie Tuano, and I am the Assistant Regional Director for SAMHSA in Region 3. Like Trish had said, I am part of HHS Region 3, and I'm really happy to be here. And the slides are gone. Oh, there they go. So I just wanted to roll through a couple of them. I don't want to take up too much time. We have key priorities and guiding principles. Here's our little map. Like Trish said, we're broken up into 10 regions. You can see Region 3 over there. The regional director is Dr. Jean Bennett. I'm not sure if anybody here is familiar with her. She's been the regional director for SAMHSA now for, I believe, 11 years. She, when they began to have regional directors in the regional office, she was the first one for SAMHSA, and she still continues to do this job today, and she loves it. I also have a new colleague. Her name is Anna Whitney, and she's a Regional Behavioral Health Advisor. SAMHSA loves their titles. I'm not really quite sure. Let's see. And this is what our regional offices do. You don't want to hear about that. Okay, so here, this is the SAMHSA webpage for grants. You can go right here to samhsa.gov/grants, and you will see all the way down the bottom, you can see the forecast for the grants that are coming up, and you can go in there and place your order. It's real easy to look up. This page used to have absolutely no filters. It now has like about 9, and you can go in and you can filter it down to your state, to your region, to your congressional district, and look to see where the grants are at and what is available. And then SAMHSA's grant programs for services for homeless. I just wanted to go through these real quick. They have, I'm sure some of you are familiar with them. There's the PATH, there's the SSI, SSDI Outreach, Access and Recovery, the SEWR grant, Community Mental Health Services Block Grant. You will find all of these on the SAMHSA grants page. The Substance Abuse Prevention and Treatment Block Grant, there is provisions in there for homelessness and housing. And the State Opioid Response Grant, that's actually the most money. The state receives this money, and then it is distributed. We are a pass-through organization. The government gives it to SAMHSA through legislation, and then we pass it down to the state, and then they pass it down through organizations. What I really wanted to touch, the SAMHSA store. So if you need any resources, my superpower, where is Maria? My superpower is I am the resource queen for SAMHSA in Region 3 and a couple other regions too I help out. So the SAMHSA store has publications. They are all good for digital downloads. If you want it in its original form, sometimes they're on there. You can actually buy the original form, like the format. SAMHSA also funds the Homeless and Housing Resource Center. It's a technical assistance center. They do a lot of work with communities, and if you need a direct connection, you can log into their website and go directly and request anything from them, or you can come to me. And then I would be remiss if I didn't talk about 988. And for those of you who have not heard of 988, it did not replace 911. It is in addition to 911. The 988 is the new suicide and crisis lifeline, call, text, or chat. And this is so you get a behavioral health response instead of a law enforcement response. There could be a law enforcement response when it's dialed into the call center, and if it's needed, they may come. But Delaware has done a great job at fleshing out their continuum of care. Somebody to call, somebody to respond, and somewhere to go. And for those of you who would like Delaware 988, I call it swag. Please come over and see me or give me your business card, and I'll make sure that I connect you with Delaware to have that for your organization. So it's really important to have. I think there was one other thing I'm not going through, but I didn't bring my Narcan in with me. I just did want to talk about, we have an overdose prevention and response toolkit. There's a lot in there, and I believe pages 11 through 13 is how to identify an overdose and how to reverse an overdose if you have Narcan on you. And I also had with me, if you want to come see me, the website to get your free Narcan from Delaware if you would like that. So I have my end of presentation here, so I'm going to keep it moving. But I will be here for the rest of the day. You want to drop off your cards to me, or I'll give you my card, and I'll be happy to connect you. Like I said, my superpower is resources. So
All
thanks
right.
for listening.
Yay for resources. All right. Trish and Jean, if you want to come back up, does anyone have a question for one or both of them? All right, well, that works out. Thank you so much, ladies. We appreciate you. All right, if you didn't hear me earlier, if you did not sign in, please do. We want to stay in touch with you. And I also want to remind you that we have a QR code. It's out on the registration table. Please fill out the survey. We want to hear from you about today, and then also about what other topics we might be able to address for you or sessions we can put together. So with that, I'm going to invite Armand to come on up to do his presentation. And we're going to keep this thing rolling, try to get back on time. And Armando Vasquez is a public affairs specialist with the U.S. Department of Agriculture, Food, and Nutrition Service. And I do want to acknowledge that we have another superhero in our midst, and that is Andrew Dinsmore with the U.S. Department of Agriculture. He is the State Director for Rural Development for Delaware and Maryland, and we welcome him here. He isn't going to speak today, But he is here if you have any questions. So just wanted you to know that he is in the room. And we're happy to have him. All right, Armando, we're going to try to get your slides up. We had a little switch up here. So if you want to go ahead and get started, we'll get those slides.
Hi, hello everyone. Again, I'm Armando Vasquez. I am a public affairs specialist with the USDA Food and Nutrition Service Mid-Atlantic region. Our coverage is New Jersey, Delaware, Maryland, Virginia, West Virginia, DC, Pennsylvania, and lucky for me, Puerto Rico, because I get to travel to Puerto Rico, have some fun time over there. But our superpower is basically we provide, we have 16 nutrition assistance programs that we partner with state, local agencies so they can administer them. Some of the services that we have, or our programs, some of you might already know about. Like, for example, the National School Lunch Program. That's a program that the USDA FNS funds. WIC, Women, Infants, and Children, is also another one of our programs that we fund. SNAP, formerly known as, I forgot what it's called. Food stamps, there you go. That's also one of the programs that we administered. So I just wanted to talk a little bit about them because one of our partners is going to talk about our child nutrition program from the state level. So obviously we are the ones who fund it and it's run at the state level, so I don't want to steal her thunder. So the one thing I wanted to do is, in regards to our programs, FNS, we have a definition for homeless, and that is basically specified in the statute. The term homeless means individuals who lack a fixed, regular, and adequate nighttime residence. So that to us would be considered homeless when it comes to our programs. Oh, there it is. Yeah. Okay, good. So basically our mission is our superpower. If you were to read our mission, that is our superpower. I was just discussing what the definition of homeless is. Next slide. And these are some of our programs that FNS administers. Again, like I said, SNAP, WIC, National School Lunch Program, the School Breakfast Program, the Child and Adult Care Food Program, and this is a new one that was just recently rolled out in 2024. It's the Summer EBT. So basically we also have the Summer Food Service Program, which is our old name is now called the Summer Meals Program. I'm sorry, the Some Meals Program. So the Summer EBT is basically an additional funding that is given to families of school-aged children so they could actually benefit from two programs. They could go to one of the summer meal sites and have a delicious lunch. And at the same time, if they qualify, they would also get a $40 per month per child, school-aged child, that participates in those programs. Next slide. So our biggest program is actually SNAP. That's what we call, our bread and butter. And basically, it provides food benefits to low-income families to supplement their grocery budget or so they can afford the nutrition food essential to health and well-being. And how are you eligible for SNAP? The next slide will provide you with more information, if I'm correct. Yes. So basically, as you can see, these are the requirements to qualify for SNAP. So you must have the maximum gross monthly income that you can have as an individual in Delaware, because each state is different. For example, let's say you only make $2,130 per month for one person, you qualify for SNAP. And then to the right of that or left side, looking at it, you will see how much you will get per individual and so forth. Another one of our programs is the Employment and Training, SNAP ENT, and basically this is a program that allows us to partner with organizations that can provide you for training, and therefore you can become self-sufficient. Those who are experiencing homeless are exemption from the ABOD provisions of July 2023. So ABOD basically means able-bodied adults without dependents. And let me read to you what are those. Okay, so basically in ABOD or able-bodied adult without dependents, is a term to describe low-income working adults in the United States who don't have dependents and are required to meet certain work requirements to receive SNAP benefits. So in order to receive SNAP benefits and you consider an ABOD, you have to be between the ages of 18 and 52. So if you're between the ages of 18 and 52, you're physically and mentally able to work. You do not live with or eat with a child under 18. You are not pregnant, and you are not exempt from food assistance work program requirements. You basically qualify as an ABOD. And therefore, there are restrictions to how long you can receive SNAP benefits as an able-bodied adult without dependents. Next slide. Our Child Nutrition Division school nutrition programs. Again, my partner, state agency partner, will discuss that a little bit in more detail, but basically those are the programs that we administer. The National School Lunch and Breakfast Program, the Special Milk Program, which basically provides milk to schools so that children are exposed to healthier drinking options. The Fresh Fruit and Vegetable Program, which is basically is an educational program that allows schools to have this program. The USDA will provide them funding. They could purchase vegetables, produce, et cetera, and they could introduce them in the classroom and teach the children how to teach children at an early age and expose them to nutritious and healthier options than what they would receive. The Farm to School program is another one of our programs that we have, and basically that allows for farmers to be able to connect with schools and either provide them with like vegetables and stuff and sell it to the school so they can be served in the school lunch. And at the same time, it also allows them to go to schools and give classes to children to teach them about where their food comes from as they call it, from the ground up to the table. Okay, next slide. Our Supplemental Nutrition Division programs. Again, these are WIC, the Farmers Market Nutrition Program, and the Seniors Farmer Market Nutrition Program. Basically, those two programs, what they do is they allow WIC participants would fall under Farmers Market Nutrition Program. What it does is it gives them additional funding. So it gives them like about, I believe it's like a $20 voucher for them to go to a farmer's market and purchase produce. And the Seniors Farm Market is basically almost the same thing, but it's for seniors 60 and above. And again, they have to meet, income eligibilities. Next slide. And then our Supplemental Nutrition Division, which is our food distribution programs. Those are the programs that we have that we partner with food banks, food pantries, et cetera. And what we do is we provide them with USDA foods, or as well as funding so that they can go ahead and provide those benefits to those who need them. Next slide. And child nutrition, community nutrition programs. Again, I discussed a little bit earlier, basically the SUN programs, which is the Summer Food Service Program, that's what our old name. But basically what it does is that we partner with local agencies that they provide lunch during the summer months. So children who meet, as a matter of fact, children between the ages of 5 to, I believe, 18, there's no income eligibility. You just go to a meal site and you will get a lunch. The Sun Buck, like I said, is different. Now that's more geared towards the school-age children. So you have to kind of qualify for that. And there are ways that you can automatically disqualify based on enrollment in school. If you receive free and reduced school meals, you're automatically almost enrolled in there, and you will get that $40 per month per child for the 3 months that are during the summer. Next slide. And these are our links for our FNS programs. And our contact information is our regional administrator, which is Dr. Patty Bennett, and our deputy regional administrator, Diana Lindbacher. So if you were to contact either one of them, they can put you in contact with staff within our office that can, that you can discuss it better, and you can, I guess, connect through to them on how to run our programs. And basically, that's it for me.
Thank you, Armando. Thank you so much. Please take a seat because we'll have some questions afterwards, okay? I'd like to call Brittany Coleman up to the mic, and she is an education specialist for nutrition programs with the Delaware Department of Education. And, you know, oh, we got applause. Thank you. We wanted Brittany to come because we want to showcase how the federal government works with our state agencies. We need each other. And so, Brittany, I hope that you can share how our federal dollars, resources help you to do your job here in the state of Delaware.
I have a PowerPoint. I didn't print it out, so hopefully
Yes,
there
we
go.
have it.
Awesome.
There you go.
Thank you. I am the education specialist for nutrition programs at the Delaware Department of Education. We are the state agency that administers the child nutrition programs in the state of Delaware. And our superpower is feeding kids. So we administer several child nutrition programs throughout the state to ensure that children of Delaware have access to nutritious meals year-round. We work with USDA to implement the school nutrition programs, the summer food service program, and the child and adult care food program. Under the school nutrition programs, there are several different programs. We have school breakfast program, National School Lunch Program, the Fresh Fruit and Vegetable Program in the elementary schools, After School Snack Program, and then the Special Milk Program. So there are a few ways that children can qualify for free and reduced price meals at school. There's the traditional method, which is family fills out the meal benefit form, and the school determines the eligibility based on income or categorical eligibility with SNAP or TANF. There's direct certification, which automatically qualifies children for free and sometimes reduced price meals. In Delaware, we have a demonstration project so we can qualify children for free or reduced price meals using SNAP, TANF, or Medicaid. And then some other categorical eligibility areas are homeless, foster, migrant, or runaway children. And then we also have the community eligibility provision. We have about 150 schools in Delaware right now that implement this provision, and this allows all children at the schools to eat breakfast and lunch free of charge. So there's no forms required, no paperwork. All the kids that are enrolled are eligible for those meals for free. So students experiencing homelessness, we have homeless liaisons in our schools who communicate with the nutrition program directors. These children are automatically qualified for free meals, and this extends through the entire school year. And so if a child is experiencing homelessness at the beginning of the school year, but then finds temporary or permanent housing later on, they are still receiving those free meal benefits throughout the school year. It does need to be redetermined each school year, but it is good for the whole year. There's no paperwork that's needed for that as long as the documentation is on file at the school. This is just some data from 21-22. We don't have any newly released data yet. And this just is some numbers from schools. I can't even read that right now. 15 or more homeless children enrolled. And this doesn't include children who are in childcare or maybe 18 and over, but this is still a pretty high number, so you can see how these school meal programs are really important. The summer food service program is another one that we operate when school's not in session. There are open meal sites statewide, and last year was the first year of permanent rural non-congregate eligibility. We do have some of those sites in Sussex County, a couple in Kent, but mostly in Sussex. All of these sites are located in area-eligible locations, or they determine eligibility using income of their participants. Free meals are available to all children up through the age of 18, and it offers 2 meal benefits per day. So they could do breakfast and lunch, or breakfast and supper, or lunch and a snack, a couple different combinations that are available there. We've seen a lot of increase in mobile meal distribution. So school districts will have food trucks that go out into the community and make stops and have meals available for the children there. They go to the kids when the kids can't get to them. There is no paperwork required for a summer food service program at these open meal sites. We try to target populations that we know are high population of children, such as motels or parks or community centers. So we have a lot of meal sites all over the state. Next slide, please. And you can find these sites in the summer months. We start posting them usually in June. We'll post them on our website. You can go to USDA. There's a link on the pamphlet on my table for that, or you can call 211. And then our last program that we implement is the Child and Adult Care Food Program. So these operate in daycare centers, family daycare homes, outside school hour programs, at-risk programs, emergency shelters, and also in adult daycare facilities. The eligibility is very similar to the school nutrition program. They fill out a meal benefit form. If homeless is indicated on the form, all meals are reimbursed to the participating center at the free rate. For the at-risk programs, there are no eligibility forms required, but the school does have to be in an attendance area where at least 50% of the children qualify for free or reduced price meals. And all meals in the participating programs are served to the child for free of charge. We want to make one note on the last slide. We have about 398, 400 centers, daycare centers approved in CACFP right now. So we recommend looking for a center that participates in CACFP because the children can receive those meals at no cost to the family. So it's a great benefit to the family. And then, of course, there's only so much we can do. So we do try to make partnerships where we can. Slide. There's a couple on there. I'm not sure if we can. I can't see it, but we partner with the Weekend Backpack Program, school food pantries. We kind of work to make connections between different partners. And then, as Armando mentioned, there's the Summer EBT Program, which is a new program as of 2024, and families can receive those benefits and still go to a summer food service program site to receive a free meal that day as well. That's all I have. Our contact information is listed here.
Thank you, Brittany. And if you want to take a seat. Any questions for the two before us here on the panel? Armando says, don't be shy. Oh, there we go. Let me get.
Qualifies. We do have 3 shelters right now that participate in CACFP for the children. It's a lot more streamlined than a typical CACFP childcare program, just due to confidentiality and safety concerns.
So then obviously it has to be a shelter that serves children as well.
Yes. Yep.
Okay. Thank you.
Any other questions? All right, well, we thank you so much, Brittany and Armando. Thank you so much. And so our next presenter is Asia Cagle. And she is a loan specialist with the U.S. Department of Agriculture's Rural Development Service. And again, Andrew Densmore is here, the state director for rural development, and he is also available to answer any questions you might have. So, Asia, it's all yours.
Good afternoon. Again, my name is Asia Cagle, and I'm with USDA Rural Development. I'm a loan specialist, and we would consider our superpower financing at low rates for community facilities and transitional housing, as well as small grants for equipment and vehicles. USDA Rural Development, our primary responsibility is to serve rural areas with a population of 20,000 or less. That can be towns or cities. And we look to build up communities for access to capital and funding, which would hopefully attract new businesses, quality jobs, and economic growth. Specific to homelessness and homeless providers, we would be looking at direct guaranteed loans, which are the low interest rate loans that we offer. Those are for nonprofit organizations and public bodies, towns, municipalities, cities, transitional housing, and again, small grants at the maximum of $50,000. As far as direct and guaranteed loans go, the eligible purposes would be to construct, expand, or improve facilities. You can also acquire a facility, something that already exists, you can purchase. These are things such as food pantries, food banks, food hubs, greenhouses. We can also refinance debt as long as it's less than 50% of the project cost that you're looking to purchase. Our rates right now, for instance, are 3.875. They do change quarterly for a 40-year term or the useful life of the facility, and there's no prepayment penalties for the loans. A direct loan would be a loan straight through USDA, and the guarantee loan would be approval through a bank, and then they would be the approved applicant for the nonprofit and public body. Community facilities are considered hospitals, health clinics, community centers, schools, daycares, as well as transitional housing. Specific to transitional housing, the services provided is for homelessness, drug, alcohol addiction, or crisis havens. This is also financing at low rates, which is construction, expansion, improvement of traditional housing facilities. There are criteria for transitional housing, and it pretty much is for the residents have to be having supportive care from the transitional housing. It is temporary, not to exceed 2 years, and transitional housing also includes sober living, domestic violence, and shelters. It can be just women's shelters or just men's shelters, and if you do have a women's or men's shelters, you have to show the capacity that you have both. Because with rural development, you have to be fair. It can't just be for women. Springbrook Collaborative is an example of a small grant that USDA funded. This is in Georgetown, and I work with them. This is one of my projects. Our small grants are for vehicles or equipment only. During the pandemic, we had a special initiative, which was the Emergency Rural Health Care. At that time, we could go up to $1 million in grants. That supported staffing, food costs, those things. At certain times of the year, we may get special initiatives, but normally our grants are for a maximum of $50,000, and it's based on eligibility of that area. So 75, 55, 35, or 15% is the grant that you could receive. There is a matching element, so if you're eligible for 75, you have to match 25, and it depends on funding. So right now with the government, we're in a continuing resolution. We haven't been awarded anything, but depending on how much funding we get is how much we'll be able to receive and then give out to our applicants. This is the CF resources page, which is a guide that you guys would be able to have access to, which walks you through as an applicant for our grant, for our loans, as well as our grants. My resource table out there does have packets as well that speaks to grants and loans, as well as potential, not only in my area is community facilities, but we do also have single-family housing, multifamily housing and rural development, as well as water and waste. So we do sewer things depending on what your facility or nonprofit would need. And this is my contact information. Again, I am Asia Cagle. My program director is Terry Ferentz, who's listed below. And if you guys have any questions, you feel free to email, call, or contact me.
Thank you, Asia. So who knew that USDA did transitional housing? Who knew that? All right. Any questions for Asia or our State Director, Dinsmore? Any questions?
I'm at the table in the back, so if you guys come up with anything, I'm there, so you guys can ask me. Thank you.
All right, thank you so much. All right, I think that we are now at a break so that you can actually go and ask Asia any questions that you might have had. So let's take another 10 minutes. We're going to be back at 3:15. Hydrate, energize, get empowered with the information, and we have Social Security and the General Services Administration, GSA, coming up, and you don't want to miss those. So please go and enjoy the resource tables and something to eat and drink, and then come back at 3:15. Calling all attendees, time to take your seat. That 10 minutes is too short. Calling all attendees, back to your seats. Calling everyone, back to your seats. Oh, sorry, Andrew. Calling everyone back to your seats so we can get started, and we'll have another break so that you can visit with our esteemed federal partners and our state, our state Brittany Coleman from the Department of Education. All right. Councilman Rocha, if you wouldn't mind putting that survey link back up on the monitors. I've been pushing this all along to tell you that we'd love you to use this QR code to do our survey, to give us some feedback on today. I know you're going to tell me that 10 minutes on our breaks was not enough. I agree with you already. But so please fill out that survey. We want to know what opportunities we could provide in the future for information exchange, whether it's with philanthropic organizations, with our state agencies, whatever you need. We certainly want to hear about it and see if we can't do something to make that happen. Real quickly, I just wanted to bring State Director for Rural Development, Andrew Dinsmore, to the stage in case anyone has questions, and I'm going to put him on the spot, see if he wants to say a few words. Any questions for Director Dinsmore? We're so excited to have him as the State Director for Maryland and Delaware for the USDA Rural Development.
Well, I'll start by, my superpower is surrounding myself with awesome women, and Matt Heckles, but Asia Cagle and Kate and all the women and program directors at my office, and Maria Bynum, Secretary Fudge when she was here, but surrounding myself with awesome women is my superpower. And my wife. Yeah.
Be proud. This is live stream, so you have proof that you said that, okay? And all your staff as well, proof that you gave them that pat on the back. So how has the job gone?
It's great. I've got awesome staff, and I've got people like Asia who are executing earmark agreements that Congress gave us. And it's been fun to learn some about the housing, the single family and multifamily housing, and some of the water and wastewater projects we've been able to fund in Delaware and Maryland.
That's awesome. Awesome work that you're doing. And you know, that's something we haven't talked about, is congressional earmarks. Another path of funding. But I know that was...
No, Kate Rohr's still here. Do you want, from Senator Kuhn's office, if any of you have questions. Okay. Well, do you want to go first with that?
Asia, you can come on up. And we'll make this real quick because we got 2 more presenters.
To answer your question, a lot of what I talked about today as far as financing for this audience here for homelessness would be constructing and building facilities. We don't have a lot of grant dollars, which is what a lot of people look for. And the earmarks being brought up, or the CDS grant, comes from Congress. And a lot of those are approved based on what they're looking to approve for the year or what they seek as eligible for that year. So we have some that are doing highways, some that are constructing newer facilities, and those are larger grant dollars. So you would have to apply essentially very early to get those funding dollars if your project does approve. But we have some that are awarded $1 million for constructing fire facilities. We have some that are doing $2 million for highways. So those are other avenues through USDA that you could get large grant dollars if that's something you're looking for as well. It is a tight window and not very hard to apply, but it is a tight window and you'd have to get it in and be looked to get approved. But we do facilitate those loans, so grants. We would facilitate those grants to help you guys with that. The small grants I mentioned, those are based on funding availability. The good thing about us is like no pre-penalties for our loans, very low interest rates for the loans that we do offer. We do have single family housing, which is based on income, not your credit score. So your income determines how much your home purchase would be. And then we do have water and environment, which are our sewer programs, which depending on what kind of facility you have, we could connect towns to water, have you have access to clean water and those different things. It just depends on what you're looking for. A lot of the conversations we have start as a simple conversation and then we get you down the avenue of where you could go based on what rural development program that you would qualify for.
We have a housing preservation grant program that is a fair amount of work for not a ton of money. We didn't get any applicants from Delaware last year. We've had sort of sporadic interest from Delaware. It's $50,000, $60,000 to do home repairs. We usually have 4 or 5 groups in Maryland apply for that. And so if someone is interested in that, that's a program we've run. We funded a food bank of Delaware program for more like a job training program. And we have a program that also funds sort of a workforce development program. Again, it's sort of like $40,000 or $50,000 as well. But those are 2 programs that we handle. One's RBDG and the Housing Preservation Grant sort of are 2. A lot of the discretionary money that we used to have is going towards earmarks that Congress directed us to spend, and so we don't have as many discretionary funds like we have in the past. But police vehicles, sewer, small sewer projects, or feasibility studies are things we've done.
All right, thank you so much. Thank you for that impromptu. We put you on the spot, but you did a great job. So thank you so much for that. All right, well, let's get back to our program for the day. Our next speaker is Matthew Baxter, and he is a public affairs specialist with the Social Security Administration, and we're all interested in Social Security. So please let me move this out of your way. Thank you.
My pleasure. Good afternoon, everyone. My name is Matt Baxter, and I am Social Security's Public Affairs Specialist covering Delaware as well as the Eastern Shore of Maryland and Virginia. So I'm here today to talk to you a little bit about how Social Security helps lift people out of homelessness. That is our superpower, by the way. Our benefits do lift millions of people out of poverty. So with that being said, let's get started. Disclaimer, this information is current as of today, but our policies are subject to change, so please refer to our website for the most up-to-date information. Just to give you a sense of what the Philadelphia region looks like in terms of Social Security, we have 131 field offices throughout the Mid-Atlantic, including 3 here in Delaware, 1 per county. We have 1 in Newcastle for Newcastle County, we have 1 in Dover for Kent, and we have 1 in Georgetown for Sussex. We just moved back from Lewis. We were there for about a 10-year stint and have gone back to our home that we were at since 1935 in Georgetown. Let's see. All right, so some key strategies include us being an active participant in the United States Interagency Council on Homelessness, USICH. We assist people experiencing homelessness with the SSI and SSDI application process, and we coordinate with Social Security field offices and other federal agencies. We also coordinate with other benefits entitlements. We work with veterans and other special populations. We assist those who are collecting SSI and Social Security benefits post-entitlement, so after being awarded benefits. We provide outreach to underserved zip codes, and we have partnerships with community organizations such as SOAR. Speaking of SOAR, it's a national project that's funded by the Substance Abuse and Mental Health Services Administration. It's designed to increase access to SSI and Social Security disability for eligible adults who are homeless or at risk of homelessness and have a mental illness, medical impairment, and or a co-occurring substance use disorder. The SOAR project provides training on how to complete the SSI, SSD application process to service providers working with individuals experiencing homelessness. We also provide referrals to other agencies. One example would be the U.S. Department of Housing and Urban Development's Continuum of Care program that promotes community-wide commitment with the goal of ending homelessness. To connect with a local COC for assistance, you can follow the link on the slide. So how can you help us? You can help individuals apply for Social Security disability benefits as well as SSI. You can help individuals complete part of their application process on our website, which is www.ssa.gov. And you can also help them by providing transportation to interviews or by helping them gather medical evidence. Now, a service provider may serve as a contact person, an appointed representative, or a representative payee. And that third item, representative payee, is where you or your organization handles an individual's benefits who are incapable of handling their own affairs, and you can also speak on their behalf when contacting us to do things like update their address, telephone number, direct deposit information, etc. Now, under Social Security, there are two titles. Well, there are multiple titles, but there are two titles that yield the monthly benefits that we offer. There's Title II, which includes SSDI, Social Security Disability Insurance, and that comes with Medicare eventually. And we also have under Title 16 SSI, Supplemental Security Income, and that comes with Medicaid. Now, we also have programs, of course, outside of the disability sphere. Under Title II, we have benefits for retirees and survivors. That would include widows, widowers, but also minor children, children who are still in high school up until their 19th birthday, as well as children who are born with medical issues or who develop medical issues prior to turning 22. Then we have SSI for aged individuals. So once you turn 65, you do not need to be found disabled to qualify for SSI. You simply have to have the financial need for the program. Now, as you're, I'm thinking, all aware in this room, there is a substantial difference between Medicare and Medicaid. Medicare is federal health insurance for people 65 or older, as well as those who've been collecting disability benefits for 24 months, whereas Medicaid is a state health program for people with low income and limited resources. In most states, including Delaware, children who get SSI will be eligible for Medicaid, and in many states, including Delaware, Medicaid comes automatically with SSI eligibility for adults as well. For the sake of time, I'm not going to go down every line item here, but in terms of the differences between Social Security and SSI, but the key difference is Social Security is an earned benefit, something that you pay into with your FICA taxes, whereas SSI is a needs-based benefit. This is just a definition of disability for an adult. You have to have a condition or combination of conditions that will keep you from performing substantial work, which this year is defined as the ability to gross above $1,550 a month. Next year it's going to be $1,620. And it has to be expected to last at that level for at least a full year or be a terminal condition expected to end in your death. That is what qualifies you for Social Security disability. So it's a very tough standard to be approved by, no question about it. You also have to have had recent work to qualify for Social Security disability. These work tests do not apply to SSI. SSI is purely based on the medical condition and the financial need of the individual. Okay, and these are the requirements for getting SSI. Bear with me for 1 second. There we go. So again, we went through these already, so this is just kind of to summarize what would qualify you for the SSI benefits. Now, for the homeless population, payments can be received in multiple ways. We can have them deposited into the homeless individual's personal bank account. We can have the benefits mailed to a third party. We can have a relative or other third party serve as their payee, or we can issue them a direct express debit card. As far as how to apply for benefits, we always encourage online filing. That's the fastest way to get the application to us. If you can't file the claim online, you can schedule a phone appointment or an in-office appointment. Oftentimes, as you know, a lot of initial claims for disability get denied, and a lot of people's question at that point is, what's next? Well, what's next is the appeal process, and you want to make sure you file that within 60 days, which is the window that you're given. This is what our website, our homepage currently looks like, so just be aware of that. We went through a redesign last year. And at the top right-hand corner, you'll see the sign-in button. This is what starts the process of setting up a My Social Security account. We strongly encourage this for everyone 18 and older, whether they're collecting benefits or in the workforce, whatever the case may be. There are benefits for all. So with that being said, it's important to realize that while you can help someone to create the account, they have to be physically present with you and meet these other criteria. Even if they verbally give you permission to set up the account for them, you can't do it without them present with you. Also, you can get help setting up the account by visiting your local Social Security office if you're having difficulty setting it up online. And then applying online is the fastest way to request a Social Security card. Just go to our website and answer a few questions to find out the best way to apply. And we have this wonderful QR code that you can scan to start the process. What to know when you're visiting the office: this is what the check-in booth essentially looks like. This is express check-in, so you basically just let us know why you're there. This is a list of all the public affairs specialists in the Philadelphia region, with one exception. I believe we still have Elaine Cole, recently retired, and presently Kimberly Stevens is covering her region. I know most of you folks probably are not handling cases out in Elaine's or former territory. All right, so with that being said, I'm going to turn things over and see if there are any questions. Thank you.
Okay, any questions? Oh, yes, here we go. Let me come on back there.
Hello.
Okay. Thank you, Councilman Rocha.
I was just wondering what the Social Security Administration's stance or recommendation is with individuals that are on that fixed income and securing housing. They're not able to meet the requirements of income that landlords are setting. Do you all have any recommendations or stance on that?
Sure, and just for clarification, are you saying that the benefits that they are receiving from our agency is not sufficient enough to cover their needs?
I am stating that when individuals on fixed income from Social Security are applying for housing, landlords are often asking for 3 times the rent amount, which is above fair market rate. What is the Social Security Administration's recommendations on that?
Understood. That, unfortunately, is not an area that we really can delve into. We don't administer the housing pieces. All we can do in this case is provide the person with a benefit verification letter so they at least have proof of what that income is. And it also is proof that that is all they are eligible for from our agency. But it would not be appropriate for me to comment beyond that because, again, this is an interaction between our agency and, some other organizations that handle the housing piece. Really, the best we can do as, a federal agency handling those benefits is provide proof of the income, take the applications, pay out those benefits as quickly as possible. I wish there was more that I could say on that topic, but that's about all I can say on that. Any other questions?
All right, thank you so much.
Thank you.
Okay, our next presenter is from the General Services Administration. Another Matt, Matthew Grace. And he is a property disposal specialist. So what's your superpower, Matt?
My superpower is the let's get it done attitude. So you come to us, let's get it done and help you out and move on. So we deal in personal property, and so if there's something out there that you need and we have it, let's work on letting you get it.
Sounds like a plan.
Yeah, so. And I think we broke a record today of how many mats we had present today. So I think we're running like 300. Yeah, so that's like Hall of Fame stuff there. So very cool. So again, everyone, my name is Matt Grace. I am a property disposal specialist with General Services Administration, and I'm here to talk to you about the federal surplus personal property donation program. So since I'm the last guy here, I have like 75 slides. So hopefully dinner plans are...
He's joking.
No, I'll get you out. It's real quick. So basically what happens is with the government, federal government having all this extra property, there's a process of it to follow through the federal and then the state. And within the state, the nonprofits are eligible to gain a donation of this property. So some examples going here would be blankets and furniture and vehicles, just stuff to help out with your certain type of nonprofit or your community group. And so up on the screen is some of the statutes there that we're not going to get into, but just goes to show you what we lean on to help agencies out during that. So back in World War II, how we got started was all the extra property that came back from World War II, the government didn't have a home for it, so they started actually GSA to help extend the life of a useful federal asset. Oh, am I going right way? Right? Yeah. So basically what it is, it's just we are the guardrails of the process of getting you the property that you need. And so we work with your state, having you get to, now it's working the right way, the property that you need for your nonprofit. So we deal with public agencies, nonprofits, veterans, 8A organizations, veteran-owned organizations, and such. So here are some of the statutes again. So there is eligibility documents that we won't get into, but we're always here, like I said, if you want it, we have it, you got it. And so this here was actually I was supposed to slide in an executive order from the Biden administration that kind of cuts out all of the red tape, allow the federal government to deal a lot more effectively with nonprofits to be able to get you that property in a timely fashion. Yeah. Yes. All right. So here are some of the recipients there. You can see we deal with a whole bunch of American Red Cross, Big Brothers, Big Sisters. So if you have a certain nonprofit that fits into that, we can make it work. And again, we're all about working with you, making sure that you get that. Next slide. So the state agency responsibilities, it's just pretty much oversight of the program, making sure that any sort of issues are addressed and taken care of. Next one. So, and then there's an eligibility or a restrictive period before you actually gain full 100% ownership. It's usually about 18 months on that. Next slide. Here are some of the, we're in the home stretch now, so that's good. Here are some of the things, property that we donated. Instruments, thank you, to schools. Next one. A truck that some nonprofits use to pick up, move people around. So it was really created a nice value for the donees. Next slide. So here is the Keystone Blind Association that we were able to help. They gained a car. The next slide should be a picture, if not. Yes, it's a 2006 Ford Taurus that they were able to take people around to doctor's appointments and shop with them. Next slide. Here's another one. This one, they had a flagship telehealth command bus that they outfitted to be able to go around and help their constituents. Next one. So we always get a ton of water that we're always giving out to nonprofits. Next one. So to enroll, get to your state agency for surplus property, contact myself. My contact number will be coming up shortly. There it is there, matthew.grace@gsa.gov. Call me direct at 215-446-5849. And I can actually point you in any direction that you have in the country or even in Europe there too. So next one. So any questions? So here is, we were actually doing a homeless outreach in Erie, Pennsylvania earlier this year, and this is our team helping them out, setting up warming stations and getting much needed. That chair behind them came from an office that they were able to gain. So just as a warming station for the homeless, instead of, it's comfortable in there for them now. So they have blankets, they have sheets, they have clothing that we're able to provide for them. So that's pretty much it. So that's again, us working with a nonprofit in Erie, setting up a donation there. So.
Thank you so much. Let's hear it for the mats in the room today.
Yes, the mats rocked it today. Thank you. And that's it.
Any
So,
questions?
Any questions?
Oh, yes. Hold on. Let me get to you. Get my steps in today. I'm so proud of myself.
Well, hi, my name is Carly Johnson. I'm the nose case manager for Dover Interfaith. I wanted to thank you for your time today, but also I don't know if I misinterpreted the slide, but it said something about paying a fee before you acquire the donation.
Yes.
Is the fee proportionate to the property that you're receiving, or is it a flat rate?
It is proportionate to the original acquisition cost, and that's a great question. So if something costs $1, I believe in the state of Delaware, it could be like 5% of that. So it would be 5. So it would be like that. And if it's an actual need, we can also work with that with the state too. Yep, sure. Great question, thank you.
Anyone else? Oh, here we go. See, Matt, you're getting all the questions.
Yeah.
I think when you talk about free stuff, it makes people excited, or almost free stuff. I guess my question was about the relationship between your office and the state, just to make sure I have it correct. So if someone wanted to see what was available, they would be getting it through the state office that was in partnership with you, not directly through you. Is that correct?
That is correct. So the way the process works is the state actually, you sign up with the state, you actually can fill out a needs list, and then the state can request a donation from us to that. Or you can, I always work with nonprofits too. They come and I'll look for it. So, but the actual transaction is through the state.
I saw another hand. Oh, that was his question too.
Mm-hmm.
Well, I learned something today, but you know, this is a perfect example of how the federal government works with the state agencies.
Yes.
We work hand in hand, and so it's really good. Lots of good information. Thank you for sharing that.
Great. Reach out to me anytime. I come out of Philly. So. Thank you, sir.
Well, we're on time. I can't believe it. We started a little late, and we got all excited, but we're back on track. And I do want to give you some time to visit with the, federal partners. But I did want to, again, Councilman Rocha, if you will put up that last slide. I'm great at the ad lady. Please do the survey. Can't say that enough. And I wanted to get our federal partners to come back into the room following, when everybody's asked their questions and they're free, because we do want to give certificates to thank them for participating today. But I wanted to give the mic over to our Matt, HUD's Matt, to kind of close us up and send us on our way, and to thank you all for being here and sticking it out. And for those on the live stream, thank you so much. We want you to fill out the survey as well. So, Matt, here you are.
Thanks. I think we should all give Maria and her team here a wonderful. You know, we had a couple practice runs of this type of convening in Pottsville, Pennsylvania, and then we did one out in Allegheny County, Pennsylvania. We're planning them in other parts of sort of the Mid-Atlantic region where we brought this interagency council, regional interagency council together. But this one I think was really special, and maybe we're learning from our previous experience, but we've had, there's more, I think, service provider participation in this event today, and I think that's Maria and others that have sort of spread the word about this. I hope it was useful. I hope it was informative. I've sat through a couple of the Matt's presentation a couple times now, and always still learn something new. And I think that's the point. Even if you think you know what federal agencies have to offer, there's probably more. And so I hope that also you created some connections today so that when you have a need, you know who to call and get some questions answered or some resources to help you, to help the people that we're really here to serve today. So thank you all for being here. Thank you again, Maria and your team. Thank you, everyone, for, is there a question? I think that's going to happen. How do we make sure that everyone, is it just from the registration? Was there a registration? So if you registered, you submitted an email? What about the folks that are online?
Well, I'm sorry. Anyway, we are going to provide you with a link, the link that you actually saw during the break. We want your feedback because we want this to be a part of many conversations we have with you about resources, sharing information, as well as us getting to know all of the providers. So when you get that link to give your feedback, please do so, because that helps us. And if you need anything, you have any questions, you can contact the point of contact on the email, which will probably be either Clark or myself, and we will send that out to you. And so if you need it, I don't want to repeat myself. My apologies. It's been a long day. But thank you very much for attending. And if there's anyone that you know who attended today who didn't register, please feel free to share that information with them, because only the individuals that signed up or gave their information at the registration table will get that email from us.
And that's Benita Johnson, one of the Delaware HUD team. Yay! Clark standing there also. So thank you very much, Matt.